Hello and welcome to Module 5, the clinical rotation and specifically the clinical day. The purpose of this module is to give you an overview of the total rotation and to help you successfully plan and implement your assigned clinical rotation. I've broken this module into several shorter video presentations with additional videos from nurse educators and students to illustrate different aspects of clinical teaching. Additionally, please access the Clinical Toolbox module for tools and strategies. The Clinical Toolbox contains specific tools that I created as well as others to assist both you and your students. Some of the teaching strategies are discussed in both modules. Hopefully, after completing this module, you'll be able to construct a teaching plan for the clinical rotation, and you'll feel better prepared to utilize some of the teaching tools as well as individualize your teaching strategies to your own clinical group. I'd like to draw your attention to the reflection and discussion questions. Please reflect on the questions as you move through the module and then discuss your thoughts with your mentor. Here are your assigned readings for this module, and there are several chapters assigned from Gaberson. I have embedded the URL links to the articles when possible. I've also given you some supplemental resources for when you're ready to look for more information on a particular subject that's talked about in this module. Also, you'll notice that I have some CUSIN learning modules for you with their links embedded. There's lots of teaching strategies that are associated with the CUSIN modules, so take a quick look at those and see if there's something that you might be able to bring into your own clinical experience. Not every time, but there might be something that happens during a clinical day that says, ooh, I'd like to find something to talk about at post-conference next week, something like that. The National League for Nursing Competency Number 1 is the most obvious with this module. Nurse educators are responsible for creating an environment in the clinical setting that facilitates student learning. Read through the task statements and use them as a guide for the multiple expectations for how we are to go about facilitating student learning, and you'll notice several are covered in this module. I want to begin by discussing some general concepts about teaching in the clinical area. I want you to think a little bit about the clinical classroom as opposed to the didactic classroom. Why is the student there? And why is the patient there? Two very different reasons. What does the clinical environment feel and sound like? If we were to design the ideal learning environment, it most likely would be described as a quiet, ergonomically comfortable space, free of distractions, not a noisy, chaotic public place filled with sick people. And yet, this is our reality. I'd like you to think about that a little bit. This is exactly where clinical teaching and learning is expected to take place, in a very public atmosphere that can be very confusing with multiple distractions. We, of course, are there because we want our students to gain the knowledge, skills, and the appropriate attitudes to practice as a nurse. Our nursing ethical code of conduct says that the patients are our first priority. So when we think about students caring for patients, we need to be sure that we are confident about a student's ability to perform a skill or procedure safely. Because remember, our first priority is to the patient. Although we are employed to teach students, remember, our first priority remains to the patient. Has the student demonstrated this skill or procedure in the skills lab successfully? Is the student prepared? Do you feel confident in this student? When I say is the student prepared, is the student able to talk through the steps of whatever procedure they're about to perform? If they can and you are comfortable, then allow them to go forth and perform the procedure. If you are not comfortable and they cannot talk through the steps, do not permit them to do the procedure. Have them go back to the policy and procedures to review the procedure, and then recite the steps again and see if you feel comfortable. If not, remember, you don't have to let them do that particular procedure because they're not safe. Maybe they need to return to the skills lab for remediation. Maybe they need to be on a performance improvement contract. I'll talk more about this in the evaluation module. Is the student impaired? Are they too tired? Or do you feel like they're under the influence of medication or alcohol? Again, this makes the student unsafe to be in the clinical area. The School of Nursing has a policy that you need to follow regarding this concern. I'll talk again more about this in the evaluation module. I'll also be talking a little later about 2 additional high-risk air-prone activities that we do as nurses every day, and that's medication administration and communication. Now, after having said all this, the whole purpose of a student being in the clinical area is to be allowed to perform clinical skills. So if we hold them back, they are never going to progress. So that's the fine line or the balance that you as the clinical instructor will be walking with each student. Our overarching purpose is to bridge the didactic or classroom learning to the clinical experience, and for our students to become socialized into the role of a nurse. So how are we to do this? First and most importantly, prepare yourself and plan out the entire rotation. Well, you can't plan every single thing in the rotation, but have an overarching plan. Review the didactic skills lab syllabi for the time period for the clinical experience. Look carefully at the scope and sequence of the skills that the students are learning during their clinical rotation. While you can introduce new skills to the students, make sure your expectations are in line with the teaching plan of the semester. It's extremely important for your expectations to be appropriate for the student's level and progress in the nursing program. Also review the previously taught didactics and skills lab content, because now you know what you can build upon to make appropriate student assignments that will reinforce that instruction. Some instructors and nursing staff are so excited to share those new and exciting opportunities to the students. And that's great, but however, the student may not have had any context for this experience. Therefore, you as the instructor will need to make sure that the student is properly prepared and debriefed. If you cannot do this, then don't send the student. If the student is to go to be exposed to this new opportunity, make sure that they understand the goal and the objective for going to that opportunity. And more about this later in the module. Let's talk about the clinical site. If you're not familiar with the clinical site, make sure to tour the unit as a minimum, and preferably take a few hours to shadow one of the unit nurses. And this can usually be arranged in collaboration with the School of Nursing and the unit manager. Review the student's evaluation for the clinical experience. Make sure you fully understand it and ask for clarifications if you're not sure about it. If needed, ask for examples to illustrate the expectations. Remember, you need to fully understand it to be able to complete it and to be able to explain it to the students and know if the student is meeting those expectations. So when we talk about our role, remember that students are looking to us to be the role model, to role model professional practice, to work by nursing ethics, and to develop trust. It's our responsibility to maintain patient safety and student safety. We have to practice using very clear communications between both the student and the staff. In the beginning, we develop our course procedure sheet or our expectations. The expectations for students should be clearly stated, and then we need to follow through with them. We need to manage each clinical day looking for learning opportunities for our students. We are the resource for our students, and we provide other resources as needed. We are the liaison between the staff and the students, or maybe between the staff and the students. We observe the students conducting patient care, medication administration, their assessments, individual patient care encounters and procedures, and provide feedback, as well as both the midterm and the final evaluation. The instructor is responsible for making the assignments. You may take the student's input, or you may allow them to have the freedom to make their own assignments. Of course, check or clearing that with you. Most importantly, keep the student's scope and sequence of learning in mind. Additionally, you may collaborate with the charge nurse in making the most appropriate patient care assignments. We lead pre- and post-conference clinicals. Students report their plan for the day and throughout the day to us, their instructor. Throughout the day, instructors encourage students to think about what they're learning, ask scaffolding questions, encouraging evidence-based care, encouraging students to practice using sound clinical reasoning and judgment. We provide the encouraging support at the same time, keeping our hands off, if at all possible, allowing the student to do the patient care. We are constantly looking for that bridging opportunity between the classroom and the clinical. In order to prepare the student, we need to give them the expectations in a handout. This gives them a general picture of what will happen during the clinical rotation. For help in developing your first expectation handout, go to the policies and procedures as well as the learning outcomes to ensure your expectations are in line with the School of Nursing. Additionally, ask your mentor or the clinical coordinator for a handout written by another instructor that you could use as a guide. In general, you'll need to make sure students know when and where they are to begin the rotation, as well as any preparation work that needs to be completed. If possible, give the students access to your clinical expectations before the rotation begins. Then go over them again on the first day with students with an opportunity to clarify any questions they may have. And we'll talk more about the first day in the next presentation. However, don't forget to go over the learning outcomes and the student evaluation with the students too. For the very best clinical experience, do not skimp on the time spent preparing the student. So what's the student's responsibility? Well, they should come prepared, on time, rested, and in the correct uniform with all their supplies per the nursing program guidelines, with their completed preparation work if it was assigned. Students need to be open-minded and willing to take on these new responsibilities and procedures per their current scope of practice. They should be aware of their own boundaries, knowing what is and is not included within their current scope of practice. According to Beck, nursing students report that the initial clinical experience produces the most anxiety of any clinical day. Therefore, to help students make the most of their first clinical day, faculty must understand the meaning of this experience for them. The nursing students in Beck's article reported feelings of being overwhelmed with anxiety, feeling abandoned, encountering reality shock, envisioning themselves as incompetent, and doubting their choices of becoming a nurse. And the author reminds us to reassure the students, letting them know that they don't need to be perfect, that we know that they are just beginning. And I know that I have had to do this with students more than once. And also, pairing students is a great way for them to have support in any new clinical area, not just on their very first clinical day. Students attending Oregon Health Sciences nursing program were assigned to read Beck's article and then write their reflections on their first clinical day. I've included the link for you so that you can read Ruby's reflections of her first day. It's really insightful to hear what she has to say. And she reminds us that everything is new and everything is difficult, as well as there is a lot to learn in a very short amount of time, and these couldn't be more true. Understanding how students feel can help us to be more supportive as we begin each clinical rotation. I can't help but think that maybe you are feeling a little like this too. Read Beck's articles for more ideas and strategies that you could use to support your students on their very first clinical day. In this module, we talked about preparing for the clinical rotation. In the next presentation, I'll discuss the clinical day, making student assignments, and some teaching strategies.